New COVID-19 restrictions in central Illinois could be announced in as little as just a couple of days. Good Friday evening, I'm Tyler Lopez. Amber is on assignment. We passed the 8% positivity rate today, and at the state level, Illinois broke the single-day record for new cases of COVID-19 for the third time this week. But that's not what has state leaders worried most. It's the number of COVID-19 patients being treated in the hospitals that makes up tonight's top story. That number has nearly doubled since the start of the month, and the health department director says downstate Illinois isn't near the worst of this second wave. At today's briefing, Dr. Ngozi Ezike explained that regions 6 through 11, which is everything from LaSalle County to the southern border, is already seeing record high COVID-19 hospitalizations. And as COVID-19 cases rise, they know hospitalizations will soon follow.
We are getting into territory that most of these hospitals had never seen before. If you forecast out with the amount of cases that we're having, which suggests a certain number of hospitalizations in the future, we do predict that there could be shortages in as short as 2 to 4 weeks.
You can see the surge in the Tri-County area today, too. Hospitalizations at an all-time high in Peoria, Woodford, and Tazewell County hospitals. New restrictions in our region would start by closing indoor service at bars and restaurants, something the Illinois Restaurant Association says will cripple their industry. The owner, Greg Bones, says he's hoping to get some help.
Well, I'm hoping that there's going to be at least more grants to get us through paychecks. I mean, paychecks are our biggest expense, so if you can cover payroll, you can pretty much cover everything else.
He is the owner of Bones, and he says he intends to follow whatever restrictions are put in place, but that's not the case for everyone. The Illinois Restaurant Association says 90% of restaurants in the state will be forced to stop indoor dining by Sunday. Capitol Bureau Chief Mike Militich explains that they're demanding the governor negotiate a different plan.
IRA President Sam Toya says 55% of Illinois operators find it unlikely the restaurants will remain open if heightened conditions are still in place 6 months from now.
The most conservative estimates say that a minimum of 20% of our restaurants will close down here in the state of Illinois. That means we will lose over 120,000 jobs.
Several speakers in Chicago emphasize the hospitality industry is being singled out, even though restaurants are heavily regulated and inspected for health and safety. Many are afraid they'll have to close their doors for good without financial assistance from the federal government, as the state can't provide nearly enough funding to help everyone in need.
What the governor is doing is killing us. He's losing our jobs. We're losing jobs. We can't pay our rents. We can't pay our mortgages. We can't pay for health care.
Now the organization is partnering with the Restaurant Law Center to craft an amicus brief to support restaurants currently challenging the Pritzker administration in court. Toya says the courts need to hear exactly how these restrictions have impacted the industry. Governor Pritzker says he understands the drastic hits to their industry, but he's not budging on mitigations.
The idea that we're going to, make the locations that are amplifying the number of cases and the spread, the transmission of this virus, that we're going to open those even more at this point makes no sense.
Still, the Restaurant Association says no establishment should treat this situation as a free-for-all to defy the governor. They stress restaurants must follow public safety guidance.
We will never support bad actors, and we encourage operators not to disobey public health guidelines.
Reporting in Springfield, Mike Militich, 25 News.
So if the rolling positivity rate for our region, Region 2, stays above 8% for 2 more days, more state-imposed restrictions could return to central Illinois. But restaurants do have places to turn for that if and when it happens. Andy Bernhardt explains.
COVID numbers on the rise, Region 2 could face more state-imposed restrictions, negatively impacting local businesses, especially restaurants, as indoor dining would halt. However, the city of Peoria has multiple resources to aid and assist local businesses.
We are able to provide technical assistance to help them, number one, find out about grant opportunities and loan opportunities. In addition to that, we can provide technical assistance where we can assist them with actually making applications not only to the city of Peoria, but to the state or the federal government.
When it comes to restaurant and business restrictions, communication is key in order to make it easy for consumers to continue to support local businesses. And CEO of the Greater Peoria Economic Council, Chris Setti, says a strong social media presence and extra consumer accommodations can go a long way.
Do you have an online ordering platform so that people who want to order from your restaurant, can easily do so? Have you been set up with Grubhub and Uber Eats or some other sort of delivery mechanism?
So what can consumers do? They can keep an eye out for local businesses, look for where to carry out, and of course, follow CDC guidelines.
So our small businesses are truly the heartbeat of our economy here in Peoria. And if we want an economy that works for everyone, an economy that is equitable and inclusive, our small businesses are the best engine to do that.
If the Region 2 positivity rate stays above 8% for the next 2 days, the mitigations would likely be imposed next week. That includes no indoor dining or bar service. Reporting in Peoria, I'm Andy Bernhardt.
Andy, thank you. 49 counties in Illinois are now under a COVID-19 warning tonight. The only one in central Illinois is Knox County, and it's on that list for the second straight week. In fact, 5 of the 8 risk metrics are in the orange. The positivity rate is the same at 12.2, but cases per 100,000 people are up from last week to 445. It should be 50. Emergency room visits also up along with deaths. The state also says the testing numbers in Knox County are still far too low.